Hello everyone, my name is Hailey Bong, and today I'll be talking about the importance of combining AI with medical ontologies. So imagine you're at the doctor's office and instead of a human diagnosing you, it's an AI doctor called ChatGPT. You describe a couple of your symptoms, maybe you have chest pain, maybe your heart hurts, something that can be serious, but the model confidently diagnoses you with a headache. This happens because today's AI makes decisions based on text patterns, not on clinically verified relationships. And in medicine, this kind of off-target reasoning can lead to dangerous or even light-threatening adverse outcomes. Medicine is an area that can always be improved. And having AI use this data from ontologies, which is information like drugs, medicine, and diseases, we already have these data sets online, like the gene ontology, drug bank, or disease ontologies in general. But that means models can currently drift off target without even realizing it because they aren't grounded by these ontologies. So our question is, how can we design an AI system that uses ontology-based medical knowledge to detect when its reasoning goes off target and corrects itself before it leads to adverse effects? The idea is to build a pipeline that links a semantic library like SemLib with an AI reasoning model. The system will take in one or multiple medical ontologies, represent that knowledge visually through knowledge graphs, generate predictions, and then measure how far those predictions deviate from ontology-defined offset targets. This deviation score becomes an early signal that your model is going off target, a way to detect hallucinations, contradictions, or clinically unsafe reasoning before they can turn into harmful recommendations. So my hypothesis is, if we ground an AI model in a medicine-based ontology, and measure its deviation from ontology-based targets, we can reduce off-target reasoning errors by at least 20 to 30% compared to a baseline model without ontology reasoning. So we will measure success using metrics like accuracy, consistency, and contradiction rate compared to a model without ontologies. And as part of this project, we're conducting a focused analysis on pralsetinib, a targeted therapy used to treat RET-altered cancers. So pralsetinib is an ideal test molecule because it has well-defined molecular targets, RET fusions, and RET mutations. It has clear adverse interactions which are documented in drug bank and cancer ontologies, and it is used in complex clinical decision pathways, making it a strong case for detecting off-target reasoning. By grounding our AI system in the ontology-defined relationships for pralsetinib, its protein targets, metabolic pathways, drug-on-drug interactions, and disease indications, we can test whether the model stays on target, whether it hallucinates unrelated mechanisms, whether the deviation score we have correctly flags unsafe or contradictory reasoning. So this case study helps us evaluate how well the ontology-guided approach performs in a real clinical scenario involving precision oncology. So our project explores how to combine LLMs with structured medical knowledge so AI can reason more safely and reliably. By introducing deviation scoring, ontology grounding, and molecule-specific case studies like pralsetinib, we aim to reduce off-target patterns early, lowering the risk of adverse side effects or dangerous misdiagnoses for real patients.